We are from Sir Gangaram Hospital, Institute of Minimal Access, Metabolic and Bariatric Surgery. Today, we are going to have a good discussion among ourselves so that it benefits the patients at large. I will ask my colleague Dr. Vivek Bindal lot of blunt questions so that everything is conveyed clearly. I will give him some embarrassing moments also so that he is not shying away from telling the cost or telling the complications or telling the negative aspects of it. Dr. Vivek Bindal, what do you think? What is the meaning of robot?
So the word robot was actually used by a Czech playwright in 1920s, which meant uh, forced labor, forced labor in Czech language. That he gave the master-slave concept, and he wrote a novel. Karel Kaplan. He wrote a novel where he dreamt or he created three characters which used to follow the master. So it's basically anything which works on a master slave concept is called a robot. An actual robot is a machine which can do a task independently and it has artificial intelligence. Once we use surgical robot, it's actually computer assisted navigational surgery where a digital platform helps us to perform our surgery and it acts as an interactive platform between the surgeon and the patient. So whatsoever movements we are doing sitting on the master console of that robot are translated in the patient's body by the instruments of robot. The surgeon's hands are not there inside. The robotic instruments are there inside, but the movement of those robotic instruments are guided by the surgeon's hands, which are using the master console. So it's a very different kind of concept, but yeah, it's a master-slave concept. The surgeon is the master, robot is the slave, and together they do a good job on the patient's body.
Dr. Bindal, one of my patients, you would also remember that when we operated on him and he was 180 kg, and when we operated and did robotic sleeve gastrectomy on him, when we went out to show the specimen of the stomach, then his wife, she asked curiously, Dr. Bhatia, Dr. Bindal, robot has done the surgery or you have done the surgery? And when I told them that obviously we were on the driver's seat and robot was just like a automatic car that we were able to drive, so she just had some kind of different facial looks. How would you answer that? Is the robot doing the surgery or is it the surgeon doing the surgery?
Yeah, that's a very valid point. There is a mental concept of robot being like something like a human being who comes and he'll operate and surgeons will be just sitting laughing around. But here it's very different. The surgeon is doing the surgery using robot as a tool. So this is something which we need to explain more to the patients. We would always tell them that it is the surgeon which is the most important part of that team. But yeah, the surgeon, once he has a robot, he is able to do a better job as compared to the same surgeon once he doesn't use a robot or he does a laparoscopic procedure, because that robotic platform is enabling platform that enables that surgeon to perform a higher degree of precise job, to perform a procedure with less complications and better outcomes in the same hands.
Do you think, Dr. Vindal, that you have become a better surgeon if the robot is available? Has it enhanced your craftsmanship or your craftsmanship is the same but the tools have been added on to facilitate and give you better results?
Yeah, I think my craftsmanship remains the same. In fact, uh, it may decrease if you are just using the robotic platform, because uh, robotic platform would enable you to do jobs which are very difficult with a lower degree of skill. But then I am able to perform jobs which very experienced surgeons are not able to do laparoscopic. So as we do hand sewn gastrojejunostomies, there is a lot of driving of needle in a very obese patient with a huge liver and lot of fat, and you are driving the needle in different directions, sewing the stomach and the bowel together. So that is made very much precise and easier using a robotic system. If we do laparoscopy, most of us would do a stapled anastomosis. That means we use staplers to join the two structures, but in robot we can sew it. We can use the suture and we can do the actual hand sewn anastomosis, which is the gold standard. So that is the difference. It enables you to do a better job while your skills are the same.
You mean to say that safety is added?
Safety is definitely added because we get three-dimensional vision, we get a stable platform, the scaling of motion, we can actually fix as if my hand is moving by 5 centimeters, the tip of instrument will move just by 1 centimeter. So we can add a lot of safety, and there are a lot of built-in mechanisms to stop any mishappening from occurring.
Dr. Bindal, what do you think if I issue a statement, and you have seen that in many workshops I have been saying so, a fool with a tool is still a fool. A surgeon who does not know the surgery or who does not know the tissue planes or he does not know the anatomy well, if I give him a tool, and that is a tool which you are mentioning is robot, if he sits on the console of the robot, he will still remain a fool or he will become a better surgeon.
No, you are absolutely right. A fool with a tool will remain a fool. So it is like it's not AK-47 only, but the person who is behind AK-47 who is important. So you need to know what surgery is to be done, how it needs to be done, what are the planes, what complications can occur, how do you manage them. Robot just enables you. It doesn't have any intelligence of its own. It cannot perform even a single step. It cannot guide you through the steps. That is your mind, that is your experience, that is your expertise, that is your skill set which is going to sail through these difficult situations. But yeah, it enables you to do a better job, and that is what is important.
I strongly endorse that point that robotic surgery is an enabler. It enables a surgeon, an average surgeon or a good surgeon, to do a better job, a safer job for the patient. For example, I always say that if somebody has to go from New Delhi to Chandigarh, which car will be safer, Maruti or Mercedes? The driver would remain the same. So if I am the driver in Maruti and if I am the driver in Mercedes, which one will be safer? The Mercedes will be safer. So in robotic surgery, because of the equipment, because of the automation, because of the computerization, because of the assistance of these kind of so-called expensive instrumentation, that we are adding safety to the procedure, and that is why the patient has better recovery. The patient is able to move around, especially with our kind of practice. When we do robotic bariatric surgery or robotic weight loss surgery, the patient is able to shift himself out of the operation table onto the bed, and within 5 to 6 hours, once the effects of anesthesia have weaned off, then he is or she is able to move around, and next very day the patient is ready to go in for walking, and then maybe within 48 hours most of our patients go home. So the recovery is definitely faster as compared to laparoscopic surgery. Any other advantages as compared to laparoscopic surgery do you see with robotics?
So robotic is a very futuristic platform. It actually allows you to do many things which you can't do in laparoscopy. Robotic platform has got a technology where you can integrate the operative images with pre-operative investigations, like we get CT scans, MRIs or ultrasound done, and with the intraoperative image you can integrate them, and then you can always compare, and the pre-operative images can guide you as to this is the vessel you need to leave and this is the vessel you need to cut. So apart from that, there is something called ICG fluorescence or firefly technology. So the robotic platform is equipped with near infrared vision spectrum, where we can see blood vessels separately from the tissues. We can see bile duct in a gallbladder surgery separately from the tissues. We can identify tumors. It can be a physiological marker. We can we can actually decide as to what is the part of liver which you need to resect if you are taking out a liver tumor, or what is the part of pancreas which you need to take out. So that is something which is very very futuristic. Apart from that, there is a lot of development being done in the area of augmented reality right now, in which you can actually have something like a GPS. Like we have GPS in cars, and it tells us, okay, this road is crowded, don't go there. You take this shortcut, and this will be a better road, or there is a dead end there. So it guides you well in advance. This is how the robotic platform can also guide you. That this is the pulmonary artery. Don't divide it. Don't go near it. Just uh, just goes by the side of it. So this is something which is a reality now, which is happening, and these are all very promising uh, developments which will change the way surgery is practiced right now.
In robotic surgery, honestly, I consider myself, or when Dr. Vivek Bindal is sitting on the console, we consider ourselves as Formula One racing car drivers. If the Formula One racing car driver is sitting on the car and he wants to drive very fast on a highway, then he has to have the backup that is very very strong. That means whole of the team has to be geared up in such a manner that failure is not an option. So in this kind of high tech technology, we believe that we are adding safety by having that concept. Failure is not an option, and that is the reason that we are able to tackle those kind of patients who are, for example, 95 BMI, 85 BMI. We have operated on patients who are, for example, 270 kg, 290 kg, and we are operating and seeing that when we are doing the suturing, the end result is more or less same, that as if we are operating on a patient of 100 kg, whereas we are operating on a patient of 240 kg. So this kind of precision, this kind of convenience is added on just because of, as he mentioned, because of the three-dimensional view, because of the lift of the robotic arms, because of the stable platform, and then concept that nothing can go wrong. That is adding on to the safety. Dr. Bindal, for how long Sir Gangaram Hospital has been doing robotic surgery?
So Sir Gangaram Hospital acquired its robotic machine in March 2012. It has been more than 4 years now, and it is one of the largest centers in terms of volume in robotic surgery in Southeast Asia. If we talk about robotic bariatric surgery, uh, our department has been the pioneer in starting robotic bariatric surgery in Asia, and currently we do the maximum numbers, and we have the maximum experience as well as publications in the field. We do a lot of research in robotic bariatric surgery, and we have published in international journals of repute. We have presented our data across the world, and we have been invited in various conferences uh, across the globe, including US and Europe. We have had mentors, we have had faculties from all centers of excellence, and they have come here, they have operated with us, we have gone there, we have operated with them, and there's a lot of sharing of knowledge which keeps on going, and that keeps us uh, at the helm of affairs. We keep on brushing our knowledge, and this is how we keep on progressing. We the last 4 years have been very good for us, and we hope that it will be much better in times to come.
To put it in a crude words, how many robots are there in India?
There are between 20 to 25 robots in India.
How many centers in India are doing robotic weight loss surgery?
Only 4 centers right now.
How many cases are being done, for example, annually in Sir Gangaram Hospital on robotic bariatric surgery?
It is between 75 to 100 cases.
And what kind of range is being done robotically?
So we do almost everything from thoracic outlet to pelvic
No,
inlet.
no, no. I am asking you about what kind of range is there of robotic weight loss surgery. robotic bariatric surgery? For example, sleeve gastrectomy, gastric bypass, and VBG, and so on and so forth. Tell me.
Yeah, so if we talk about bariatric, we are using the robot to perform sleeve gastrectomy, which is the most common operation now done for bariatric surgery. We also do Roux-en-Y gastric bypass using the robot, and there is a very different technique. We do a hand sewn gastrojejunostomy. So that means we are we are sticking together the stomach and the bowel using a suture rather than a stapler. So that actually helps decrease the complication rate in gastric bypass. We also do a lot of revisional bariatric surgery using the robot. So we have operated on many patients who had complications because of bariatric surgery somewhere else, and then they have been referred to us with either complications or weight regain, and we have converted their procedures into some other procedures. In those kind of difficult and challenging situations, robotic system helps us a lot by providing its advantages, and it enables us to do a better job in those patients.
Many centers in which the robotic surgery is not available because it is a costly affair. It is costing around 10 crores of rupees for the basic equipment, and then they added on the disposable instrument cost. Many centers or many surgeons who are not doing the robotic surgery, they label that the surgeons at Gangaram Hospital or those surgeons who are doing worldwide robotic surgery, they are doing gimmicks rather than the actual play. What do you think about it?
Yeah, it's not a matter of what I think, but there's a lot of published evidence to it. There's a lot of published literature which supports this finding that once you use a robot for a bariatric procedure, the number of complications go down. And it has been proven time and again by centers across the world, including Asia, Europe, and America. We have done similar studies in our center, and we have found that the complication even in super obese and regional cases go down by using a robotic system. We published our data in Journal of Society of Laparoscopic Surgeons US, in Obesity Surgery Journal, which is again published from America, and Journal of Minimal Access Surgery. We also reviewed all the published literature available till date, and we have statistically analyzed, after comparing around 3500 patients of laparoscopic bariatric surgery with 3500 patients of robotic bariatric surgery, finding that the stomal complication, the anastomotic complication, the bleeding rate, the leakage rate goes down after using a robot. So it's not a gimmick, it is definitely an advancement in technology. There are many people, as in every field, who are laggards in adopting technology. It is the same like when mobile phones came, people didn't want to leave their landlines, and when CDs came, they didn't want to leave their cassettes. When aeroplanes came, when cars came, everybody was saying that these machines, how can they drive on road or how can you fly in air? But it's so common now. And robotic system is something which is going to change the way the surgery is practiced, and everybody will be using it in future.
What is the cost difference between the laparoscopic surgery vis-a-vis robotic surgery, in especially for concern with the weight loss surgery?
In bariatric surgery in our hospital doesn't charge anything extra for the machine as such. So it doesn't try to recover the cost of the machine. The only thing extra which is being paid by the patients is the disposable cost of the instruments, which are imported from US. So the average cost, additional cost of a robotic procedure over a laparoscopic procedure is around rupees 1 lakh, and that would include the instrument cost. Apart from that, all other charges remain the same.
Do you think that by adding 1 lakh rupees or so, we are adding safety, we are making it more cost effective also?
Definitely, we are adding safety, because even a small complication in a bariatric patient can lead to a cascade phenomena, which can lead to a lot of drain of financial as well as other resources in terms of loss of working days and prolonged hospital admissions. So even if you save uh, one or two complications in 100 patients, you have made it much more cost effective in the wider perspective of things. So it's definitely a cost effective thing to be done, because safety is of paramount importance when we are talking about human lives.
And regarding the complications, do you think that as robotic bariatric surgeons, we add up more complications or we reduce the number of complications in patients of weight loss?
We definitely reduce the number of complications in uh, when we use a robotic system, and this is what we have actually published, and this is what we have seen, especially in patients who are super obese and those who are undergoing revisional bariatric surgery, because these are very challenging cases, and any amount of help which is provided by the robotic system actually decreases the difficulty which the surgeon is having, which in turn translates into better clinical outcomes. So if the surgeon is having no difficulty, he is able to perform a better operation, then definitely the clinical outcome is going to be better.
In my mind, it is very, very clear that we are not here to replace laparoscopic surgery. The laparoscopic surgery has a place, robotic surgery has its own place. And only thing is the surgeon should be able to combine the two technologies. The laparoscopic surgery has two-dimensional view, the robotic surgery has three-dimensional view. The precision is more with robotic surgery. The stable platform is there with robotic surgery. Surgeon is driver or the surgeon is more comfortable sitting on the console in robotic surgery, and then the cost effectiveness and the safety is definitely there more with the robotic surgery as compared to laparoscopic surgery. That is the reason that in Sir Gangaram Hospital we have chosen to do the special kind of bracket of patients who are super obese, maybe more than 50 BMI, or super obese, maybe 60 BMI and above. We are not offering this kind of surgery for patients of 30-35 BMIs, because we feel that with the help of rigid instruments the surgeon is still comfortable and he is able to do the same precision work. But if the precision has to be added, if the demand is more, then it can be fulfilled with the help of robotic surgery. Where do you see in next maybe 5 years, what will be our position as bariatric robotic surgeons, and what will be the position of robots in India, and what will be the position of robotic bariatric surgeons in India?
It's a difficult question to predict, but the number of robotic systems are going up. It's a very promising technology. People are adopting it. Surgeons are adopting it. Patients are asking for it. So it is something which is upcoming. It is something which has increased in the West also, and India usually follows the trend of the West. So we can pretty much say that the number of robotic systems are going to go up. There needs to be a lot of advancement in technology in order for a wider adoption of robotic systems, because there's a lot of cost constraint, uh, there's a lot of healthcare access issues once we talk about robotic surgery in India. So there need it needs to be cheaper, it needs to be better, which various companies are working on. They are making it so, and we hope that maybe in 5 years or 10 years we'll have multiple robotic systems which are much better than what we are using today, uh, like what happened to supercomputers, and now we have computers in our smartphones. So something of the sort is going to happen with robotic surgery. The time frame can vary from 5 years, 10 years, 15 years, but that is how I think that the surgery practice is going to change.
We in Sir Gangaram Hospital are privileged in that sense that if, for example, if the patient who are coming from US, UK, Australia, Kenya, Canada, and they are asking for the best in the world surgery, and that is a robotic bariatric surgery, we are able to offer them. But there are people who are from domestic market, they are coming from from within India, then also we are able to give them the best care, best technological care also, because there are provisions where are in Gangaram Hospital we have range from general ward to deluxe room. We can offer these kind of facilities to those patients who are not able to afford much, but still they are getting the best surgery. So our dream at the Gangaram Hospital is to make it available, to make it accessible to those who are inaccessible. Means that those people who are not able to get the best inside India, or they cannot move out to US, they should be able to get the best possible surgery sitting in Gangaram Hospital, and still it will be affordable. It can be reasonably affordable for them, as it was the case with cardiac surgery. When the cardiac surgery was started, most of our VIPs had to go to Houston or other places to get their cardiac surgery done. But with the advent of technology, with the advent of surgeries, with the advent of advancement of the surgeons, it has become such a common surgery that most of the patients don't have to go outside to get the best repair, best surgery done. So same way, in robotic surgery, we dream that the common man sitting on the road also should have the access to get the surgery that is the best surgery, the robotic surgery, and that will be ultimate dream fulfilled. Thank you very much.